She is an MD from the United Kingdom who lives in the San Francisco Bay Area with her family. She graduated second in her class from the prestigious University College London Medical School. Vivian is double certified in the UK in internal medicine and family medicine. Because of what she learned treating her children's allergies, her own mercury poisoning, and her husband's high blood pressure and cholesterol, Vivian now specializes getting her patients healthy through food and lifestyle without a prescription pad. Dr. Vivian Chen can heal where conventional doctors cannot. Welcome, Vivian, to our podcast.
Thank you very much. Thank you so much for having me on the show, and a very warm introduction.
Well, a very true one. Very impressive. Second in your class in medical school, Vivian. I haven't met many of those folks. None of my doctors, by the way, are second in their class. But Vivian, you're a physician, but when your daughter got sick, you found that you couldn't help her. And this started you on a huge journey and basically changed the course of your career.
Yeah.
Tell us a little bit about what happened.
Okay. So as you've all heard, I'm a conventionally trained MD. And when I gave birth to my daughter, I was a family physician at the time. And as a doctor, I thought I had it all figured out. I thought, I knew what I wanted, how I wanted to sleep train her, what I wanted to feed her. And actually it turned out that nothing is further from the plan that I had for her. So when she was born, I breastfed her because I thought that was, we all know that that's the best thing for babies. But from about 4 weeks of age, she started to not feed properly. So she would latch on and then come off the breast, start arching her back and look really uncomfortable and start crying. And after a while, it kind of really started to set off that panic button in me as a mother. If you're a mom and your child doesn't eat, I think it's probably one of the most frustrating or devastating things anyone can experience. So I took her to see my own doctor. I don't like to treat my own family because, as a doctor, you're told not to treat your own family. So I took her to the doctors. I saw lactation specialists. I sought out advice from a lot of different specialists. And I was told things from, your letdown is too quick. So letdown is when the milk comes out of your breast too quickly. So, she didn't like it, or, it's the way you breastfed her, to reflux. So my doctor, my own family physician, diagnosed her with reflux and colic because she was crying all the time. So even when she wasn't feeding, she was crying all the time. She never slept. During the day, she would nap for 15 minutes and wake up. And in the night, she woke up every hour. So I was like a sleep-deprived, desperate mom whose baby didn't feed. When I go out, I would see all these moms so happy with their babies, breastfeeding them. And I'm kind of thinking, what is going on? I'm a doctor. I should know how to help my own daughter, right? And it was a really, really dark time. But, as a mom, your maternal instinct takes over. And also as a physician, that kind of need to help people takes over. And I think I completely ignored my emotion. I just kind of pushed that to the side and got on with the job at hand, which is to help her. Anyway, it was a really confusing time as well because people were telling me all different things. And, I was listening to different people doing 10 million different things. But she was on antacid medications. And after a week, when it didn't work, the doctor added in another one. And she was ramped up to maximum dose. And even then, she was still not feeding and still crying a lot and not sleeping. And things got so bad that when she was 8 weeks old, she had to be hospitalized because she was so dehydrated. So they, at that point, they passed a tube down her throat, through her nose, into her stomach to feed her. And she was also given a test. It's called a pH test, where they put a probe into the stomach or into the gullet to see whether acid is actually coming up from her stomach. That's kind of like the gold standard for diagnosing reflux. And it showed that she didn't have reflux. So, we had her on all these medications and it wasn't doing anything. It was the wrong diagnosis. But anyway, that diagnosis was kind of poo-pooed. And then the doctors got to work out what's actually going on with her. And I think they were as helpless or clueless as me, because one of them actually, she was under the care of so many pediatricians because nobody knew what was going on with her. But one of them said that she had behavioral disorder. So what 2-month-old has behavior issue that makes them not feed, right? I think that was the final straw for me to start interfering, because up until then I didn't want to put my doctor hat on and start interfering and kind of be like the over anxious mom. I was anxious anyway, but I didn't want to interfere too much with her care. But when they told me that she had a behavior issue, that was kind of like, no way, no baby has behavior issue where they refuse to feed. So I started to do my own research, reading, and to my absolute shock and surprise, I came across all this material in the medical literature. So they're published in medical journals and textbooks on how her symptoms actually may be a manifestation of cow's milk protein allergy. I was so shocked because, you go through all that medical training. And as you kindly mentioned earlier, Alexandra, that I actually did very well at medical school. So I studied a lot. And even then, I never learned that her symptoms could be dairy allergy. So that completely turned my world upside down, both as a doctor, as a mom. I started to lose trust in my medical training and started to question, is there something that they didn't teach me at medical school? So that's when kind of the world of nutrition and lifestyle opened up for me.
Can I just jump in here? Your daughter was diagnosed, well, you figured out that your daughter had cow's milk protein allergy, but she wasn't drinking, she was drinking your breast milk. So explain
Correct.
to us how that was happening.
Right. So this is my scientific hypothesis. I don't think there's been too much research or studies on that, but I didn't know at the time. I know now, but I had leaky gut, had a lot of digestive issues, and that's related to the mercury poisoning that you mentioned earlier as well. So what was happening was that, we know that the dairy protein is very hard for the human body to digest. So the casein, the whey, is actually quite hard to digest. So it stays in your intestine. And if you have leaky gut, those undigested protein molecules actually start to pass from the gut into your bloodstream, which is actually not meant to happen. But when it happens, it went from my intestine into my bloodstream and then into my breast milk. It is rare, but it happened with me. And actually, when I look through the literature, there is a type of delayed dairy allergy or food allergy called FPI. So that stands for food protein-induced enterocolitis syndrome, where I think they found up to 40% of children suffering with that condition were exclusively breastfed. So even though it's not reported in the medical literature, I don't think it's as uncommon as it may seem.
Mm-hmm. So what happened? So tell the story. She gets better because
I then went and spoke to a dietitian who specializes in dairy allergy and another friend's mom who's a pediatrician. And they both said, yes, I think, it could be dairy allergy. So we switched her to a hypoallergenic formula. So it's a formula that doesn't contain dairy protein. And within 2 weeks, she was holding a bottle. So she went from feed refusal to feeding herself within 2 weeks.
So, okay, I'm confused. So if you realize it's a dairy allergy and you're the one consuming the dairy, why wouldn't you take out the dairy and keep breastfeeding your daughter?
Right. So it took, I actually did that. And so we were kind of going along it at the same time, but actually she was still, so it's a very long story. I kind of shortened it, but I actually started eliminating dairy, eggs, and nuts from my diet while she was going through all of that. And then, but even then she was reacting. So we had to go to this formula. That was because she was tube fed, and the dietitian said the fastest way to get her better was to switch to the formula. So I had to basically give up breastfeeding.
So was the problem the fact that you had a leaky gut and the cow's milk protein was getting through to your daughter? Or was it that your daughter has a dairy allergy and she happened to be exposed earlier than people thought she would be exposed? In other words, would every child who has a mother with a leaky gut get this problem? Or was it just happen to be your daughter is susceptible?
Yeah, so it's both. So it has to be that she's also allergic and that had leaky gut. That it was kind of like the perfect storm.
So there could be a dairy allergy in a newborn, which is common, and be getting the dairy through the breast milk, even if the mother doesn't have leaky gut, right? Because it's in her diet, it's in her. Because I have a question, and I'm so disturbed by and confused by. I was with my sister this past weekend hiking in Colorado. We were talking about this very subject. She can't really get away from me talking about this subject. She's probably really tired of it. And we were talking about what happened to your daughter. And she lives in Kentucky in the Southeast. So not nearly as much access as I feel like we have out here in the West on situational problems with consuming animal products. So she said, "Oh, Dotsie," she goes, "I know at least 15 friends, if not more, whose child was allergic to their breast milk. And they went to see their physician, and the physician, pediatrician, told them to stop breastfeeding their child, not look into what the mother is eating or ingesting or drinking that is in their breast milk." And so, which is just blows me away, because that milk that mother of every species, right, makes for their own young is a specific formulation for that baby to thrive. And so these pediatricians, do they just not know that there could be something that the baby is allergic to, whether it's a cow's milk allergy or nut or what I literally was like tripping down the mountain hearing this, almost in tears, because what a horrible thing for the mother to know, I now have to stop breastfeeding, and maybe they've only been able to do.
And then you asked an excellent question, and I was absolutely heartbroken. I was told to stop breastfeeding. But I think given the severity of her situation, they suggested it as a quicker route for her to recover. But the fact is that it can take up to 4 weeks for the protein to come out of your system. If someone, I guess if the child is severely sick and you have to do something very quickly, you have to feed her something, right, during those 4 weeks while the protein is working its way out of the mother's milk. But if they're having the kind of less severe symptoms, maybe perhaps when she first started to have symptoms, I immediately eliminated dairy. I could have been able to help her and probably carried on breastfeeding. But because it takes that long to get rid of the protein from your breast milk, I think that's one reason, is the severity of the symptoms. But when I went back to work, that's exactly what I did. Like, giving up breastfeeding was so hard because I know that breast milk is protective against allergies because it has all these immunoglobulins and proteins that can help a child thrive and fight against diseases later on in life. So when I went back to work, I helped moms eliminate dairy. And that's actually, at the time, my colleagues thought I was mad because they're kind of like, wow, why would you eliminate dairy? Dairy, moms need dairy. They need the calcium. And, it was such a battle. And that was 8 years ago. Nowadays, I think people are more aware. But back then, it was really frowned upon. And my colleagues almost thought I was kind of malpracticing because I was telling moms to cut out dairy from their diet. But I think that's a really good thing to raise awareness of, is that the first thing to do should be elimination of these allergenic foods from the mom's diet rather than switching to a man-made milk.
Could the mother, let's say, just because of awareness and education knowledge that we're speaking about right now, then a mother might have a baby who's not feeding well, crying, cramping, and that maybe just only goes on for a week. And now they have the knowledge to go, okay, could be an allergy. Let's test these out. Would an opportunity for the mother to continue breastfeeding be they stop, continue pumping so that they continue lactating, maybe until the protein's out, and then they can successfully breastfeed for the next 2 years. Yeah.
Okay. So when you talk, that's definitely an option. But I think even with pumping, so that's what happened with me. I carried on pumping, but the supply just dropped. So it wasn't an option for me. But I think if it works and keeps the milk supply up, pumping is definitely an option. You would just kind of throw the milk, your pumped milk away, right? But just keep the supply up,
right? And
hopefully go back to breastfeeding.
You mentioned allergens, so there are other things that also a mother could be coming out through her breast milk that are giving reactions to children. I know we're focusing on dairy, but there are others, and you are an expert on allergies. Can you tell us a little bit of the top 5 allergens that mothers should look at? Yep. And is dairy number one?
Dairy is number one. And soy is number 2. And actually, there's a lot of cross-reactivity between soy and milk allergy. So there's anything in the data between 15 to 60% of those who are allergic to dairy might also react to soy. So we always say eliminate soy and dairy at the same time. Egg is number 3. So these are all the milk, eggs, soy, and then maybe seafood, fish, sometimes gluten. Those are not kind of the main ones, but could still play a role.
And nuts? That's the famous one.
And nuts, yeah.
It's interesting because I learned about this from hearing you speak at a seminar, and the thing that struck me is that you are Asian, and your kids are either full or partly Asian?
Oh, fully Asian. Yeah.
So tell us a little bit about Asians and dairy and other ethnic groups in dairy, because white people actually don't have a milk allergy nearly as often. And maybe this subject obsesses me. This might be why the word's not getting out in conventional medicine, because most white, this is not something there's only 15% or so of white people who have dairy allergies, but it's so much higher in other ethnic groups. Can you talk to that?
So can I just make a little correction there? So it's
Please do.
I think the 15% figure is lactose intolerance. So so there's a big difference. So you might be lactose intolerant, but not dairy allergic. So an allergy is where your immune system is activated and trying to fight the food. So it's seeing an enemy in your system, and the whole body becomes inflamed trying to get rid of this food. Whereas intolerance is more a localized reaction, so your gut can't break down the lactose. So that's lactose intolerance and dairy allergy are very different things. So the 15%, I think, in Caucasians refers to the lactose intolerance rate. And lactose intolerance rate for Asians is a shocking 95%. So it blows my mind that dairy is now such a trendy food in Asian countries. So, when I went back to Taiwan, where I'm originally from, and I wanted to get coffee and tea with soy milk, where actually I grew up drinking soy milk. You couldn't find dairy very easily back then. You would drink soy milk. But it's kind of reversed. So now when I try to look for coffee and teas with soy milk, they said, no, we only do dairy. And most, 95% of those people consuming dairy are intolerant, which means that they cannot break down lactose in their gut. So the lactose passes through to the colon, where it basically rots. And then you get all these symptoms like bloating, diarrhea, cramping. It's crazy.
And the lactose is the sugar in dairy.
Yes.
To clear that up for people. I just recently saw Crazy Rich Asians. Very funny movie. And the actress in it, who's Asian, was trying to just prove that she really is authentically, fully 100% Asian. And the way she did that was saying, she said, "Yep, I'm lactose intolerant."
Exactly,
and the whole theater starts laughing because 95% of them were Asian who went to see this movie.
I understand.
Yeah,
So it's like,
what about other groups? How?
What I've read is, I think Hispanics is 50% and African Americans around 75%. So it's actually really the Caucasians who can tolerate it. And what's really interesting is I came across these studies showing that Asians who are born in this country, so born in Western countries, UK, USA, and Canada, have a much higher, like something up to 40% higher rate of dairy allergy, not intolerance, allergy, compared to Asians who are born in Asia. So that's really interesting to me. And we see data like that relating to breast cancer, for example. So Asians who live in America have a higher rate of incidence of breast cancer compared to Asians living in Asia. And for me, that suggests everything to do with diet, right? You have the same genes, is the environment that you're living in that's predisposing you. So perhaps is the food that the moms are eating when they're pregnant, when they live in this country, so that when they're born, they're already sensitized. So so as I said earlier, the food proteins, if a mom has leaky gut, it's passing through to the child. So the child's immune system, which is immature in the mom's womb, is still seeing all these food proteins and thinking, I don't like those. So I'm just going to be allergic. So maybe that's why Asians born in this country has a higher incidence of allergies.
So when you were giving the stat of 95% of Asians are lactose intolerant, right? What percentage are allergic? Is it a big difference?
The data is really hard to interpret because maybe we'll go on to that later, but there is no gold standard test for allergies. So
I wanted to jump into that. Let's do it. The difference between the types of tests, because that's what people are wondering now. Like they're sitting there going, oh my gosh, how do I get tested? What do I do? How do I clear this up?
Right.
And the difference between IgG test and IgE, I think it's the perfect time.
And you've stated that they're not very accurate in terms of detecting, and sometimes they won't detect.
That's right. So it depends on the kind of allergy. So just quickly to answer that previous question, because I think it's an important statistic, the incidence of allergy has gone up 50% in the last 10 years, or they kind of have estimated. But if you read different studies, they'll give you different rates of prevalence because it depends on what kind of test they use. So the data suggests anywhere between 2.5 to 5% of people. But that's quite a wide variation as well. So now I'm going to talk about the tests, so we can kind of maybe understand a little bit more why it's so difficult to diagnose it.
Can I ask a quick question?
Michael, we have Michael who owns the network studios where we are, and also who is our board engineer. He is our local dairy drinker and meat eater. So, Michael, what would you like to say?
Well, I mean, is it an adaptation thing? I mean, we're talking about numbers and we're talking about having, data, the data is changing. Is it just because we haven't really had the proper testing and the proper, sort of follow through in identifying with people and their diets that the number, we're seeing a change in a number, but is it really a change in a number, or is it more that we're just haven't been good at assessing people effectively?
Yeah. That's an excellent point. And that is definitely at the back of my mind when we look at things like the exploding rate of incidence of allergy, because is it just that we're better at diagnosing it? Because 10 years ago, nobody could diagnose my daughter, whereas now if I took her to a doctor with her symptoms, I probably have a better chance of her being diagnosed in a timely fashion. So I think definitely we're better at recognizing it, and more doctors are trained in kind of knowing that there are these delayed symptoms of allergy. So yeah, I think that's a very good point.
And this discrepancy between Caucasians and other people, is it because of classical conditioning? Is it because of the fact that our bodies are, super intelligent, more so than we even imagine at times, and they are able to adapt and, become conditioned to what you're feeding it? Because, at some level, it may, announce early on that, hey, why are you putting this in my body? But over time, it starts to accept it and become more conditioned to,
Yes.
Dealing with something like milk as a normal dietary supplement.
Yes, exactly. So I think that's the reason why Caucasians have a lower incidence of lactose intolerance, is because they're, I think many thousands of years ago, they're the ones who started to drink dairy. And, if you had symptoms or you had dairy allergy, you probably die back in those days. And so your genes wouldn't be passed on. So the ones who kind of, I want to say mutated, but not evolved, to be able to drink dairy are the ones who can tolerate it. So maybe that those genes are kind of amplified and evolved with time. Whereas, in Asia, we never drank dairy. So it's something completely foreign to Asian genes.
And I've got one last thing too here. I've heard a lot with people who have introduced the paleo diet to me and other diets. They all come out at, and I'm 42 years old now, and I've been drinking, a gallon of milk a day for the majority of my life. It feels like, I think that's why I've never broken a bone, because my calcium is super high. But nonetheless,
Let's talk to Vivian, Dr. Chen about that.
But I'm curious about, is there an age to which your body just simply doesn't accept milk anymore? People were telling me by the time you reach 40, your body says no to milk. And I'm 42, and my body to cow's milk, and my body does not. I don't have the diarrhea or the other effects that I hear typically from people my age have, and I just think it's because I consume so much of it, and I'm just different, maybe.
Well, you're definitely different, Michael.
I would say the human body never adapts to something that's inflammatory. Maybe over generations, if you're not passing on your genes, you may be able to adapt. But here's the thing: there's so much hidden symptoms that people don't associate with an allergy or intolerance, right? So, if you imagine that what I was talking about earlier, that the immune system is activated. So you can literally have symptoms from your head to toe. That's dairy allergy that you're not associating with dairy because you're consuming it every day, and the effects are delayed and insidious in onset. So you're not seeing it. It's not like someone drinks milk and they have this IgE, the acute reaction, where their throat closes up and they stop breathing. But if your immune system is activated and you're in an inflamed status of your body, then you're more prone to other chronic conditions like diabetes, heart disease, cancer.
So like night sweating and things of that nature could be a component of allergies to milk, as an example? Did you
say night sweating or just sweating in general?
Night sweating, like sweating at night when you're sleeping?
Yeah, so that could be, I'm just guessing here because I don't know your full history, but hormonal issues, very common. So, how much hormone there is in dairy is really scary, and people don't know that even when you buy organic milk, it's still full of hormones, because what is milk? Milk is a growth fluid that the cow produces to make a baby calf grow very rapidly. So it has to have hormones to make the calves grow, and that's how it grows. So you are literally drinking tons and tons of hormones, which then start to interfere with your own body's innate hormone system. And then so we see things like acne in teenagers, we see weight loss resistance, insulin resistance in adults. So, people who can't lose weight. Why is that? Because they're ingesting all these hormones that's interfering with their own body's hormone, and the body doesn't know what to do anymore. So there's so many symptoms that, I'm pretty sure if I spoke to anybody, I'm the party pooper, right? So I go to parties and inevitably they come to me with symptoms like, oh, I have this, I have that. And then I just ask them, are you drinking dairy? People with joint problems, they get better when they don't stop drinking dairy because there's no inflammation in the body. So if there is inflammation, there's going to be something that's impacted. And that's, depending what your genetic makeup is, what your predisposition is, it could be migraine, it could be skin, it could be joints, it could be a number of things like, sinus issues, but they're all, if you trace back, I'm all about root cause. So what is at the heart of causing of all those conditions, it's what you're putting into your body.
Right.
So if we kind of go back to the origin, I mean, we're using a lot of terms that we've created and made up in our society so that we can kind of get a little further away from the connection of what we're really talking about. So dairy is one of those words. I mean, whoever thought of that? Dairy is cow's milk. Lactose intolerance is cow's milk intolerance. And so I think I personally think it's important to change our verbiage around this because we keep people disconnected from what it really is. It's the fluid from the mammary glands of a mother cow made specifically for her baby cow to grow 3 pounds or more every single day. And we're using dairy, some people are, as a diet food, which is really quite hilarious because it's the exact opposite of that. It's made to make a baby cow turn into a 2,000-pound cow.
Exactly.
And we get 2/3 of the hormones in our food via animal foods. And so when you have guys especially being concerned that if they have a sip of soy milk, they might get man boobs, we really have to peel back the layers and go, you're drinking straight up full-blown estrogen. From the mother cow. Soy is a phytoestrogen, another conversation. But the amount of estrogen that men are taking in when they're drinking that much milk is, well, how much is it? I know it's
and by the way, she's not just a mother, she's pregnant. She's also pregnant for a lot of it, because then they only give her 2 months a year of not being pregnant. So most of the time she's actually, so she has all those pregnancy hormones going on in the milk.
So here's another epidemic that people are perhaps not talking about because it's maybe a bit tabooed, which is fertility issues. So semen quality is going down. Men have lower testosterone nowadays compared to 10 years ago. And, they're not linking that to the food that they're eating, so the food contains estrogen, and like Dotsie said earlier, it's not just phytoestrogen, which is weak. They're consuming full-blown estrogen that has a direct effect on our receptors in our body.
Now, so for people who say, well, I'm not allergic to dairy, but they might have had some of the symptoms you talked about, like mucus or acne, and they might have some gut issues. Can they just buy lactose-free milk?
No, because most of the time is the protein in the milk. So that's why I had to correct you earlier, Alexandra. Sorry about that. But
no, I'm honored to be corrected by a doctor who was second in her class. So hey,
so it's the protein that usually elicits the immune reaction. So it will be casein, whey. There's actually 20 plus different proteins in dairy that can trigger reactions in our bodies. So lactose milk just doesn't have lactose. It doesn't have the sugar, or it's broken down. It doesn't mean that there's no protein. So the proteins that can elicit immune reactions are still there.
So is it kind of a baloney kind of marketing thing to have lactose-free milk and hope that you don't have the same symptoms?
I think it's just another way to make money by the dairy industry, right? Break down the lactose. Well, I mean, the Asians who are lactose intolerant, they can buy that milk and not have the bloating, diarrhea, but their bodies are probably still reacting to the casein. and they're still, ingesting hormones.
So what do you, I wanted to ask, you gave a whole list of things that could happen could happen to people when they ingest dairy. Are there differences between symptoms between babies, kids, and adults? And can you talk a little bit about that?
Right. So this is from my own observation as a clinician. So I think in children, you have the more kind of common presentation of allergy is the acute type. So food allergies, everybody thinks, oh, EpiPen, and people, with their lips blown up, they're going blue, they can't breathe. That's an acute allergic reaction, and that's more common in children. But as you get older, and especially with our society, what we're eating, our gut is being damaged. So if you are starting to develop leaky gut, then slowly you start to not tolerate foods that you used to be able to tolerate as children. So we are now also seeing allergies developing in adults. But they can be, but they don't tend to be the acute type reaction. So they'll be the delayed type symptoms.
That's what Michael was talking about with his friends, saying they can't handle it anymore at 40. Right, exactly. So it's the those proteins from food that normally your body wouldn't see, but if the gut is broken down, then those proteins are getting into the bloodstream and triggering off reactions. Then they can start showing symptoms. And also I think there's a continuum of symptoms, right? That's how much your body can take. When you're younger, there's probably more of a give in your body that you can abuse it a bit more than, later on, as the toxins and hormones get messed up and toxins build up, your body is not able to tolerate as much as what you used to feed it.
So earlier we talked about the different types of tests for allergies and intolerance, and basically at worst they're inaccurate and at best they're confusing for people. And so I've learned that a 2 or 3 week just elimination diet of whatever you think the allergen in this case dairy is really going to be your best indicator. Is that true? And what do you suggest for people who are listening to this and going, oh my gosh, I have so many of those symptoms. I want to figure this out, but I'm worried but to go get a test because if it's not accurate. So the elimination diet, what should they do? Okay, so elimination diet,
there's several different types. It depends on what food you think.
Let's go with dairy.
Okay, so if we're just doing dairy, it's super easy. I mean, what everyone's concerned about, especially with adults, with dairy is calcium, right? We heard Michael say earlier that about calcium in dairy. So the fact is that you don't need to drink dairy to get calcium, right? You can get calcium from so many other food sources, and plant sources of calcium is probably superior anyway.
More bioavailable.
Over a dairy source. So, and more absorbable, exactly. So, it depends. I think it depends on how knowledgeable the person is on nutrition. So, I tend to go and meet people where they are at. So rather than kind of overwhelming them with knowledge, like right now you need to go and eat 3 cups of collard greens and kale every day, I might just say to them, hey, just remove dairy. And if you're worried about calcium, take a supplement for the next 3 weeks. We're just doing a test. We're just trying to see whether you feel better at the end of the 3 weeks. And if you do, then let's move on and give you the implementations that you can do so that you don't have to supplement if you don't want to. So cutting out dairy, so you're looking at cheese, you got to start reading labels, because I'm seeing products, for example, from Trader Joe's that says soy cheese, and then on the back it says casein, which is a milk protein, which then you're still going to react to. So if you're doing an elimination diet properly, I normally take people through how to read labels, and then obviously what to replace with. There's so many plant-based options, for plant milk and and yogurt that you can buy now, that I think that switch is fairly easy. It's the hidden dairy in processed foods that get people.
That's such a brilliant point. And it's just amazing to me how many places they stuff it into. There's a fair amount. I mean, about 50 to 60% of just the crackers on the cracker aisle, they've stuffed dairy in. Like, why would you put dairy in my crackers? You know, I'm just thinking there's dairy
because
in a
it's
couple
addictive.
of, well, right. Yes.
Right. So they want you to keep buying
it.
You eat the cracker and you get this high, or, the casomorphine, which is what casein is metabolized in your body, is a morphine-based chemical, right? Stimulates addiction to that reward system. So you're going to associate reward with that particular brand of cracker. You're going to go buy some more. This is really just such a backhanded way of industry trying to make money.
Okay, so that's a huge point we can't just like skim over. Can you just quickly, or not, just express and explain what happens when the casein goes in, how it is then converted to casomorphine. Casomorphine is an opiate, very specifically made by nature that way so that babies latch to their mothers.
Yeah, and they bond, right? It's part of the bonding process. But when we're eating the casein in human milk, I'm sure, produces the effect. It's the exact right amount for that baby to develop that kind of reaction without the ill effects. So, for example, I've seen studies linking casomorphine to, for example, crib death, because what an opioid does is that it can suppress your respiratory function. It can suppress how much you're breathing, basically.
So casomorphine from a cow's milk, or from breast milk?
Yes, from a cow's milk, sorry.
Okay.
And, casein is linked to increased mucus production in the respiratory tract. It has so many effects in the body.
We have to wrap. There's so many questions.
I could sit here and talk to you forever.
But we just have a couple more questions.
Yes.
Is that I wanted to know up there in San Francisco, what restaurant is your favorite restaurant at which to eat, or and if you don't have that, maybe what's your favorite dairy cow's milk dairy alternative? Okay,
so my favorite dairy alternative is homemade almond milk, and I also like hemp milk. Hemp milk is really easy to make. You just soak it and then blend it in your Vitamix. And if you're making oatmeal, you just literally pour the whole. You don't even need to filter it. You just pour the whole thing in and make your oatmeal that way. And hemp seeds has the complete amino acid profile and also has omega-3, so it's really great for plant-based.
And it has more protein per ounce than meat does, just by the way. It's 9 to 7. So
exactly.
Protein packed.
So it's a great source of protein, omega-3 for my family. Now, in terms of restaurant in the Bay Area, we're not as fortunate as you guys down there with the choices. I'm hoping that will change, and that we'll see more pop up over time. But I really love a restaurant called Millennium in Oakland. They rotate their dishes, so there's usually different dishes whenever I go there. But they are whole food plant-based, so that's one of my favorite restaurants.
Wonderful.
Yummy. So when in Oakland, that's where we're going. And that's where we're going next year when we go to the International Plant-Based Nutrition Conference in Oakland.
Yeah, I'll wait for that.
All right. We have one last question for you. What does switch for good mean to you personally?
Switch for good for me initially meant healthier bodies, healthier family. But as I switched, I realized that switch for good also means switching for a better planet, better environment, more compassionate life. It's really funny. I'm science-based, right? So I want everything scientific and to do with health. So I switched for health reasons for, my kids. But the more I've cut animal products out, and, for me as a Buddhist, we believe that when animals are killed or they're suffering, they release chemicals. And actually scientifically it's proven they release cytokines into the body, which is highly inflammatory. And I think that when we eat products like that, our compassion is kind of inhibited in a way.
Stunted.
So I did not know how dairy is farmed. I'm embarrassed to admit it, but I did not know how dairy is farmed until I became vegan. And after I became vegan, I was so shocked. But for some reason I'm just able to feel so much more compassion now without animal products in my body. So switch for good means I'm switching for the good of everything, switching for the good of your health, for the planet, for your mental health, everything.
So such a excellent point. And thank you for saying that. And one of the biggest points of this podcast is encouraging self-empowerment. So don't just believe us. Don't just believe Dr. Vivian, although I think you should believe Dr. Vivian, but go out there and understand, research, look under the cover. There's this thing called the internet. You can find anything you want and understand where your food is coming from in every way, shape, and form, every aspect. So where can we find you? Tell everyone Instagram, Facebook, where your website, how can we find you?
So I have 2 blogs. One is particularly for allergy. So, when I realized how much need there is for education in the topic of allergy, I started blogging. So that one is www.allergyfamilies.com. I also have another one called Plate for Health. So that's health through your plate. That's what it means. So www.plateforhealth.com. I'm also on Instagram. My handle there is plate4.health.
Great. Thank you so much,
Amazing.
Dr. Vivian
Thank you
Chen.
so
It's been an
much for
amazing
having me.
conversation.
Love this.
I had a great time. Thank you.
All right. Take care. We'll talk to you soon.
You too. Bye.
So thank you so much for tuning in today. If we helped you in any way, then click the subscribe button and let's keep hanging out together. We have so much more to share with you.
And if you need more information on actually making the switch for good, please visit us at switchforgood.org for loads of info. And you can subscribe to our mailing list where you will receive all sorts of super cool gifts, discount codes to our very fave dairy-free products, and a lifetime of powerful health tips.
So join us on the journey to switch for good. This is the future.